The synapse is a functional connection between the axon of one neuron and the dendrite of a cell body or another neuron. This space between cells is pictured and is where the action potential process occurs. Resting potential is the difference in electrical charges between the inside and the outside of an undisturbed nerve cell membrane. The resting neuron doesn't send or respond to other neurons. At rest, the inside of a neuron is negative, whereas the outside is positively charged. The sodium-potassium pump balances out the forces. Depolarization is the loss of an electrical charge on the surface of a cell membrane. During this process, sodium channels open and potassium channels close. The voltage-sensitive sodium channels are open, and some sodium ions diffuse inward. The membrane is depolarized, and the voltage is rising. Repolarization is the returning of the cell membrane to resting potential. In contrast to depolarization, during repolarization, the potassium channels open and the sodium channels close, causing potassium ions to diffuse outward. The voltage is falling. Hyperpolarization is reached when the negativity of the resting potential of a cell membrane increases. During this process, the action potential goes past negative 70 millivolts because the potassium channels stay open too long. In a normal brain, the axon of every neuron is protected by a myelin sheath, a fatty covering of the axon that helps contain signals that travel through the neuron. Without the myelin sheath, nerve signals can fizzle out or stop being transmitted, and the impulse may not reach its destination. In an individual with multiple sclerosis, the axon lacks a protective myelin sheath. This means that the axon is not insulated, and the nervous signals may be lost and never reach their destination. This impacts the individual in that it may cause vision and hearing problems, problems articulating and regulating speech, or pain, numbness, and, in very severe cases, even paralysis in the limbs.